Okay, we'll talk briefly about pediatric assessments. It is an entire chapter in ATI. I'll try to break down some of the key things that stick out to me in that chapter. Techniques. Now you can read the slides, so I'm not going to read them for you. But certain things that we do differently with kids than we do while assessing adults. Of course, make sure it's non-threatening environment. That's why we do bright colors and fun-looking things in pediatrician offices or kid hospitals. For infants, it's good to do the non-invasive assessments first, such as listening to the heart and the lungs. That way we're not upsetting the kid and then unable to hear our assessment findings. Blood pressure assessment's not routine during infancy. We do routinely check reflexes until 6 months of age, head circumference for that entire year because of that rapid brain growth in that first year. It's a good idea to let the parents hold the infant. And again, less invasive assessment first. For toddlers or preschoolers, you may want to ask the parents to remove clothing or let the kid do it. Let them handle and play with the equipment. Leave intrusive procedures last, just like with infants. Praise the toddler or preschooler for their cooperation. And starting at 3 years of age, blood pressure monitoring should be routine. School age and adolescent patients, make sure you explain what you're doing and why. Give them the choice if the parent stays in the room or if this parent should step out. Provide privacy. Let them know the results of anything that you're doing. Ask if they have any concerns with their body. And again, provide that privacy. Never ask a parent to restrain a child during a procedure. Also, hospitals will have treatment rooms because if they're the patient's hospital bed should be considered a safe place. So for any intrusive procedures, they should be taken to the treatment room. Vital signs. Your PowerPoint has a nice little slide in it that is from Norton Children's Hospital for their norms of different age groups. And I summarize that for you. Heart rate and respirations will continue to decrease with each age group until you get to the adult normal. Blood pressure will slightly increase with each age group. O2 saturation and temperature should stay equal across the lifespan, except for the first 10 minutes of life when we had that abnormal O2 saturation because of the alveoli being full of liquid instead of O2. But after the first 10 minutes of life, greater than 90% would be expected. Certain findings that kind of stuck out to me, and I know it's hard for you to see the slide, but you have a copy of it. Positional plagiocephaly, which is hair loss or balding spots that are from spending too much time in the same position. Treatment for that would be to change positions frequently. Make sure that a child is getting tummy time when they're awake and observed. If that doesn't help, then they may be placed in a molding helmet where that helmet can help their head take on to a normal shape. And again, that's called positional plagiocephaly. Small, palpable, non-tender, and mobile lymph nodes are normal in kids. Permanent eye color is not achieved until 6 to 12 months of age. They're blue or gray in color up until that point. For a child less than 3 years of age, we pull the pinna down and back to assess a tympanic membrane. And if they're greater than 3 years of age, we pull it up and back. So the way I remember that, down and back if the kid is short. So if they're less than 3 years of age, they're probably shorter. So down and back. Versus if they're greater than 3 years of age, they're probably taller. you pull the pinna up, taller, up, and back. Internal ear, pearly pink or gray tympanic membrane, and the light reflex should be visible. Tonsils may not be visible in infants, and that's a normal finding. Pulses in infants should be palpable, brachial, temporal, and femoral. And infant reflexes. So we talked about initiating infant reflexes when we talked about newborns. And I kind of summarized them to try to help you remember. So reflexes that tend to disappear around the 4-month mark. So sucking, rooting, the Moro, the startle, and the tonic neck reflex. So think about what happens at about 4 months of age. Sucking and rooting disappears, and we start to introduce solid foods at 4 to 6 months of age. So it's kind of nature's way of saying we don't need that anymore. The Moro, the startle reflex, and the tonic neck are an innate protection device that our bodies have, and around 4 months of age, the baby starts to be able to raise its head up off the bed, and eventually the chest, and they should be able to start to move themselves to get away from danger. Around 8 to 12 months of age, the Babinski's and the plantar reflexes disappear. And what happens around 12 to 15 months of age? The babies start to walk, and the Babinski's and plantar both have to do with their feet. So I hope that helps make sense out of determining when certain infant reflexes disappear. The next slide is ATI had a good video on vision and hearing screens for children. However, I have logged in and I'm unable to find that. So I've emailed ATI, and we will get you access to that as soon as possible if it still exists. In the meantime, on page 76 in your ATI book, it talks about vision and hearing impairments. Vision screening for children, you can use the Snellen letter chart, the tumbling E, or the picture chart. Prior to the age of actually being able to use a chart, you could see if they follow their mother's face and, just general stuff. Once they're old enough for the chart vision screening, you ask the kid to put their heels on the 10-foot mark. And remember, if they wear glasses, they are to wear the glasses during the test. You can also test peripheral vision and color vision. The color vision is usually tested with the Hardy-Rand-Rittler test. And you can also do the cover test, where you ask the client to cover their eye and observe an object at a distance of 13 inches. The cover is removed and the eye is observed for movement. Movement should not occur. Hearing testing, we talked about routine hearing screening done in the newborn period. Expected findings if an infant is unable to hear would be lack of the startle reflex, failure to respond to noise, absence of vocalization by 7 months of age, or lack of response to a spoken word. And we want to catch these things early, both vision and hearing problems, because it can lead to delayed growth and development in the child.